Hello, welcome back, everyone. So our next presenter is Spencer Chen, who is presenting on understanding suicidality in BPD Insights from Research. Spencer is a clinical psychology graduate student in the Personality and Emotion Research Lab at Simon Fraser University in Burnaby, British Columbia. She is passionate about preventing suicide and helping people with BPD build lives experienced as worth living. Her current research involves studying the internal struggle that suicidal individuals experience and integrating risk-based and life-oriented approaches to suicide. Welcome.
Thank you so much, Bailey, and thank you to everyone who is joining me today.
Yeah, of course. So I will now put your slides up for you so that you can present on them.
Thank you so much. So hi everyone. My presentation today will focus on understanding suicidality in BPD from a research perspective. And before I get started, I just want to respectfully acknowledge that there might be audience members here who experience suicidal thoughts or have loved ones who have suicidal thoughts. So I want to say at the beginning that there is hope and help is available. And if at any point in this presentation it gets a little too much, you're always welcome to step away for a second and do what works best for you.
Wonderful. Do you want me to go to the next slide?
Yeah, that would be great because the screen doesn't move when I try to go to the next slide.
Okay, wonderful. You just let me know when you'd like me to carry on to the next slide each time.
Sure, that sounds great. So sadly, from research, we know that people with BPD are actually at a higher risk for suicidal thoughts and behaviors than the general population. And there might be many possible reasons behind that. For example, many people with BPD have a history of trauma or abuse. And often people with BPD experience very intense emotional experiences that make it very hard to regulate emotions. And sometimes impulsivity is also an issue that some people struggle with. And suicidality might manifest in different ways, such as talking about wanting to die or making plans to end one's life. It is very important to take suicide very seriously and seek help if you're experiencing suicidal thoughts. Okay, next slide, please. So there are different factors that might motivate suicidal thoughts and behaviors. One of the most common reasons that people mention when they feel suicidal is psychache. So it might feel like there is just so much emotional pain and it just becomes unbearable. And it might also be that emotional pain makes it very difficult to regulate emotions. And sometimes when people are suicidal, they also have a wish to escape. This could be a wish to escape from past difficult experiences, a wish to escape from excruciating psychological suffering, or a wish to escape from responsibilities in life. And suicide may also serve some interpersonal functions. For example, like when people are suicidal, they might have that urge to communicate distress to other people around them, because it might feel like people do not understand how much pain I'm feeling right now, and sometimes suicide can feel like the only way out. And suicide may also feel like a way to problem solve when and individuals see no ways to solve the problems in life. And because of that, it may help people establish a sense of control over their lives. Next slide, please. Oftentimes, when people are experiencing suicidal thoughts, they engage in an internal debate or struggle over whether to live or die. So from research, we know that 94.5% of suicidal individuals experience suicide debate, and about one-third of people engaging in it quite regularly. So even if you might be feeling suicidal, oftentimes people also have a competing wish to live. And from research, we also know that even a very small shift in wish to live may offset the wish to die. And it may feel like like you're having a psychological tug of war inside you, and there are some like reasons pulling you towards suicide, but there are also some things that pull you towards life. Um, so there are some risk factors for suicidal thoughts and actions. First, in terms of the risk factors for suicidal thoughts, um, oftentimes people experience a lot of emotional or physical pain. And then if they also feel like it's hopeless that the situation will get better, then an individual might experience suicidal thoughts. In addition to that, sometimes when people are suicidal, it can feel like you're a burden to those people that you love, and it might be that they're better off without you. And people who are suicidal are also often also feel quite lonely and disconnected from other people. In terms of risk factors for suicidal actions, um, people sometimes have increased physical pain tolerance from exposure to painful or provocative experiences. Sometimes when people engage in self-injury, even if they may not have an intention to die, their pain tolerance might build up over time, and that is actually a risk factor for suicide. There are also some dispositional risk factors, such as some people might be born with lower pain sensitivities, and access to and knowledge of lethal means is also a very strong risk factor for suicidal actions. And one of the most powerful ways to prevent suicide is removing any lethal means. So this means removing any sharp objects and medications if a person is at risk for overdosing. And at the same time, there are also factors that protect against suicidality. So if a person feels connected to other people in their lives, or a job, a path, or even a social role, that can be a powerful protector against suicidal actions. And having reasons for living, such as responsibility to family and also child-related concerns, can also be protective. Having a strong supportive system, such as having support from family and friends, and having access to support from a mental health professional, and also having coping skills, then they have suicidal urges, can also be very protective. Okay, next slide, please. If you have a loved one who is experiencing thoughts of suicide, there are some warning signs that you could pay attention to. For example, if your loved one is talking about wanting to die or kill themselves, or looking for a way to end one's life, such as by searching for ways to kill oneself online, that could be a warning sign. And other warning signs could be talking about having no reasons to live, visiting or calling people to say goodbye, and giving away things that they normally value. To support someone in emotional pain, there are some things that you might do, such as by directly asking them, are you thinking about killing yourself? In the past, research has shown that asking about suicide doesn't increase risk for future suicidal behavior. So it's very important to ask if you suspect that your loved one is experiencing suicidal thoughts. To keep them safe, like I mentioned before, you can also reduce access to lethal items or places. And being there for your loved one can make a huge difference. So this means listening carefully and acknowledging their feelings without judgment. And it can also help your loved one connect with either a crisis line or mental health professionals. I know that on this slide, it shows 988, and this hotline actually hasn't been established in Canada. So a bit later in this presentation, I will share more about crisis lines that are available in Canada. And lastly, it's important to stay connected with your loved one and follow up with them if they're experiencing a crisis. There are many different ways to cope with suicidal thoughts. For example, there are some strategies that are focused on distraction and engaging in positive activities. This could be doing something good for yourself, such as cooking a meal that you enjoy, working in the nature, and get enough sleep. Sometimes keeping yourself busy can also be helpful. And socializing with people we enjoy spending time with can also be helpful. Another type of coping styles involve mindfulness-oriented strategies, such as sitting with feelings until they pass, finding some perspectives, and calming yourself. There are many different mindfulness apps that are available, such as Calm, and I think there's also an app called I think it's called Headspace. Yeah. Next slide, please. I also want to briefly go over some of the DBT skills that might be helpful if you're experiencing suicidal thoughts. The TEEP skill focuses on changing your body chemistry to help calm you down. And this is a type of DBT distress tolerance scale. So if you're experiencing emotional distress, you could try to hold your breath and put your head in a bowl with ice cold water, or hold an ice pack on your face for about 10 to 30 seconds, because cold temperature can be calming in some instances. Intense exercise may also be helpful, such as running fast, jumping, or lifting weights. Paced breathing could help you slow down your breath, and this means breathing very deeply into your belly. When you breathe in, you can try to do that for 5 seconds, and when you breathe out, it's normally helpful to do that a bit longer, such as for 7 seconds. And pair muscle relaxation is also a helpful strategy because it can help you relax your muscles. So when you notice the tension in your body, when you breathe out, you can stay relaxed in your mind and let go of the tension. Another distress tolerance skill is the stop skill. The first step of the stop skill is to stop when you have the urge to engage in self-destructive behavior. So even if your emotions may want you to act without thinking, it's important to stop and pause for a second to stay in control. The second step is to take a step back. So taking a step back from the distressing situation can be very helpful. So when you take a step back, you can take a deep breath and try to move on to the next step, which is observing. When you observe, you can ask yourself, what are some of your feelings and thoughts? and what are some other things we're doing in your environment. And lastly, it's important to proceed mindfully. So this means be aware and think about the situation, your feelings and the feelings of other people. And if you have any meaningful any meaningful goals in your life, it may be helpful to think about your goals as well. Next, please. Oftentimes, it can be helpful to pay attention to your five senses. So this means paying attention to taste, hearing, smell, touch, and vision. For taste, it could be enjoying a good meal and a soothing drink, and pay attention to how the meal or drink tastes like. For hearing, it could be listening to soothing music or the sounds around you. In terms of smell, it may be helpful to use a light or scented candle. And for touch, it may be helpful to put clean sheets on the bed or pet your dog or cat. In terms of vision, sometimes people find it helpful to watch a sunset or look at a picture or poster that you like. And oftentimes, especially in the context of dialectical behavior therapy, we talk about building a life worth living. And there might be like many ways to build a life worth living. And for example, sometimes we talk about taming a volcano. So this means turning any durable suffering into durable suffering. So even if the pain might feel too much right now, eventually, by learning to live with the powerful emotions and reducing the negative emotions to a bearable level, the suffering can become less intense over time. And another aspect is living a value-aligned life, which involves building a sense of purpose and meaning. So a question that you might ask is, what areas in your life do you value the most? So I have included some resources here in terms of crisis signs in Canada. So most of these crisis signs offer a phone number that you can talk to a crisis responder, but many of them also offer online chat or text option. Next slide, please. In terms of local resources, I have some resources here for Vancouver and Victoria. And if you know any other resources in other parts of the BC, you're always welcome to leave a chat, and then it might help other people to find resources in the community. In Vancouver, there is an organization called Suicide Attempt Follow-Up Education and Research. And it offers counseling services for people who are in a suicidal crisis, have made a suicide attempt, or are survivors of a suicide death. The Access and Control Center is also in Vancouver, and it provides crisis intervention and support. And it also helps with admissions to Vancouver General Hospital inpatient psychiatry, or referral to Vancouver Coastal Health Services. There's also a center in Victoria that provides crisis support, e-counseling, support group, and educational programs related to suicide. And this organization is called Need to Suicide Prevention, Education, and Support. I also want to briefly go over some of the evidence-based treatment for suicidality from research. So DBT is one of the most popular treatment options for people with BPD. It is a form of cognitive behavioral therapy that was originally designed to treat suicidal and self-harming individuals with BPD. DBT has three components, including skills training group, individual therapy, and phone consultation that consolidate skills use. There has been many research studies that shows that it can be very effective for reducing suicidal thoughts and behavior, especially for people with BPD. Another evidence-based treatment is called cognitive therapy for suicide prevention. It is a cognitive behavioral, suicide-specific form of psychotherapy that aims to reduce risk factors for suicide and enhance coping. And it is specifically designed to address suicidal behavior. With a focus to identify triggers and address coping abilities. Another treatment option is called collaborative assessment and management of suicidality. It is a suicide-specific therapeutic framework that takes a phenomenological approach, so it really seeks to understand the experiences that you might be having related to suicidality. And there's also some research evidence for this kind of treatment. Next slide, please. And lastly, before I end my presentation, I want to reiterate that so it does get better over time. So what research robustly indicate is that people with BPD can experience significant improvement over time, especially if they have access to appropriate treatment and support. And there is an overall positive trajectory over time. And many people with BPD can lead fulfilling and satisfying lives. So there is definitely hope and help is available. Thank you so much.
Wonderful. Thank you so much, Spencer. That was a wealth of information, and I appreciated you offering the lens of hope too, that people with BPD can lead meaningful lives, and offering that lens of research to like the up-to-date current information about suicidality. I'm just going to actually put the slides up one more time and go back to the crisis lines for some folks, just to give an opportunity to maybe take a picture of it or jot some down. These are our local resources that we have. There's one also, the common one that some people might be able to remember, as it's like an it's 1-800-SUICIDE. I'm sure that one of these are those a lot of the ones they amalgamate and they go to the same places anyways, but they have them regionally for the different places too, and then sometimes they go to the one call center. So yeah, 1-800-SUICIDE is another local one, and that's for all of British Columbia. So I just noticed that someone had mentioned they missed this slide, so I wanted to go back to it for folks. So if anyone wants to take a photo of that. We also have our crisis line numbers up on our website. If people don't get a chance to jot it down here, then I'll go to this one for our local resources here for folks. And yeah, we have a few minutes if anyone had any questions about resources or any research on suicidality and BPD. I know that sometimes people connect self-injury and suicide when they aren't always connected. Sometimes they can be. I don't know if there's anything that you wanted to speak to on that or share about maybe the connection or not the connection. If there's anything you had there.
Yeah, for sure. So sometimes when people self-harm, it actually helps them to cope with their suicidal thoughts. So I know that for some individuals, when they self-harm, they have no intention to die. But also there are also some people who feel both suicidal and they also engage in self-harm. So like these two things can be separate and they can also go together.
Right. Yeah, definitely. That's also my impression. And sometimes people miss that information or get that confused, or there's a misconception. So, yeah, I appreciate you acknowledging that. Yeah, and does anyone have any questions for Spencer, or any research related topics in regards? Just go back and leave that one up there. Yeah, and I appreciate you offering so many resources here for people, including for youth in different regions, and the Success Line. I've never heard of the Certified Listener Society. Is that a new one? Do you know, or I don't know. I don't know much about them.
Yeah, I'm not sure if they're a new one, but they're a volunteer-based organization that offers emotional support.
Oh, great! I'll have to look into that more. Awesome. All right. Thank you so much, Spencer. I really appreciate your time. Spencer is also a volunteer with us doing research-based projects and peer support. So I appreciate all the support you do for us too, for the society. And yeah, so thank you again for your time, and I hope you have a good rest of your day.
Thank you so much for hosting this event. Yeah, it's really meaningful.
Yeah, thank you. I appreciate
Thank you.
you. Okay,
Bye.
take care. Bye. All right. Okay. So, thank you, everyone. And we will have our next speaker up at 4 p.m. And so stay tuned. And again, if you would like more information about our programs and services, or if you'd like to check out we have different community resources, our programs and services on there. We have a crisis line. We have a resource list about like books, peer-approved websites, even like research links, like to different articles. On there, we have PDFs that you can download. You can even download the like different like articles or books on the website. More information about what BPD is and what it's not, myths and facts on our website. And of course, if you'd like to donate for our efforts to keep our DBT programs running and accessible and affordable for folks in the community, you can go to our website, which is www.bpdbc.ca. All right, we'll see you at 4 p.m.